Good afternoon. I'm Rodney Lynn. I serve as interim dean in the School of Public Health. And on behalf of the Georgia State University School of Public Health, I'd like to welcome all of you here in Atlanta, as well as those that are streaming using the live stream to participate in this 2019 Kreuter Katz lecture on health equity. I'm delighted that you're able to be with us today as we honor through this special event two dear friends and colleagues, Martha Katz and Marshall Kreuter, as well as their dedication to health equity and their enormous contributions to public health. Today would not be possible without the generous support of the Healthcare Georgia Foundation, and I'd like to take the opportunity to thank Dr. Gary Nelson, President and of the Healthcare Georgia Foundation, also serves as board chair for our Board of Advisors here in the School of Public Health. So thank you, Gary, for your support. I'd also like to recognize the committee that selects our speaker each year. And this year we had Collins Arian-Bua, Harry Hyman, Shannon Self-Brown, Gerardo Chowell, and finally Kim Ramsey-White, who will be invited to the stage following the presentation to facilitate questions and answers and make some closing remarks. Today's lecture really aims to help us better understand health inequities and disparities in our society and how we might foster solutions. This is an area of great importance and special emphasis for us here in the School of Public Health, in the research, teaching, and service that we carry out through our faculty, staff, students, and alumni. We recognize that health equities lie at the heart of the most pressing public health challenges that our nation faces. That is why we're proud to welcome and host Dr. Vanessa Northington Gamble as our distinguished speaker this year to help us hold up, honor, and learn from the life and work of activist Dr. Virginia M. Alexander, pioneer of racial justice, health equity, and public health. To tell you a little bit about Dr. Gamble, Dr. Gamble is University Professor of Medical Humanities at the George Washington University. She is the first woman and African American to hold this prestigious endowed faculty position. She's also Professor of Health Policy in the Milken Institute School of Public Health and Professor of American Studies in the Columbian College of Arts and Sciences. In addition, she's an adjunct professor of nursing at the University of Pennsylvania in the School of Nursing. Dr. Gamble, throughout her career, has worked to promote equity and justice in medicine and public health. She is internationally recognized as an expert on the history of American medicine, racial and ethnic disparities in health and healthcare, public health, and bioethics. She is the author of several widely acclaimed publications on the history of race and racism in American medicine and bioethics. Public health service has been a hallmark of her career. She has served on many boards and notably chaired the committee that took the lead role in the successful campaign to obtain an apology in 1997 from President Bill Clinton for the United States public health syphilis study at Tuskegee. She is a member of the National Academy of Medicine and National Academy of Sciences and a fellow of the Hastings Center. A proud native of West Philadelphia, Dr. Gamble received her Bachelor of Arts degree from Hampshire College, an MD and PhD in the history and sociology of science from the University of Pennsylvania. We're honored to have you with us today. Please join me in extending a Georgia State welcome to Dr. Gamble.
Thank you, Dean Lynn. Usually I like to get the setup for places. They did not tell me I needed to walk up steps because I usually wear flats, but I tried to be cute today and put on some heels. So I'm just very happy not to have fallen flat on my face as I walked up the steps. I just want to thank you for having me here today. And Martha and Marsha, I want to thank you for having this opportunity for people to learn about health equity, because I think it's very important. So I want to thank you for having and funding this lecture. So I'm going to do something different today in looking at health equity, and I'm going to take a look at health equity as a historian. So if I can remember how to do this, yep, I got it. In March 2015, the New England Journal of Medicine published the essay, #Black Lives Matter, a challenge to the medical and public health communities, written by Dr. Mary Bassett, then New York City Health Commissioner and now Director of the Francois Xavier Bagnot Center for Health and Human Rights at the Harvard School of Public Health. In the essay, Dr. Bassett powerfully and eloquently wrote of her strong moral and professional obligation to encourage critical dialogue and action on issues of racism in health, and urged health professionals, let's not sit on the sidelines. She also wrote, I would like to believe that there are at least 3 types of action through which we can make a difference: critical research, internal reform, and public advocacy. In reflecting on these possibilities, I add, she said, to nearly 2 centuries of calls for critical thinking and action advanced by U.S. Black physicians and their allies. As I read the essay, I found these words particularly compelling because Dr. Bassett's words precisely describe the work of Dr. Virginia Alexander, a Black woman physician and activist whose biography I am writing. Dr. Alexander lived from 1899 to 1949, and she tried to make a difference in the lives of her Black patients and the Black community by critical research, internal reform, and public advocacy. As a medical and public health historian, Dr. Bassett's words also resonated with me because they underscored that our work today stands on the shoulders of others. However, the work, lives, and contributions of women and people of color frequently go unrecognized. Virginia Alexander crafted a career that linked medicine, public health research, anti-racist activism, and religion. This afternoon, I will examine how she came to construct this pioneering professional life. Her biography helps, I argue, eliminate the substance and character of past efforts to eliminate racial inequities in health and healthcare, and reminds us of the long, stubborn history of these inequities. Now, in my examination of Dr. Alexander, I will not bring what I call a profiles and courage approach. My goal is not to present her as a 2-dimensional, heroic Black woman physician, but as a complex human being with strengths, triumphs, and accomplishments, but also with frailties, failures, and disappointments. Yes, Dr. Virginia Alexander was a pioneer in social justice, public health, and medicine. But as a friend cautioned her at the beginning of her medical career, you are a pioneer, and their lot is never easy. Before I examine the details of Dr. Alexander's life and career, I wanted to discuss how I came to write her biography. I first heard about Dr. Alexander when I was a medical student at the University of Pennsylvania. I heard about Dr. Alexander from Dr. Helen Dickens, who was my mentor. She was an obstetrician and gynecologist who also served as the Associate Dean of Minority Affairs at Penn Medical School and had recruited me to the school. Dr. Dickens, whose father had been born enslaved, graduated from the University of Illinois Medical School in 1934, and she was the only Black woman of her graduating class of 175. 16 years later, in 1950, she became the first Black woman admitted to the American College of Surgeons. Helen Dickens came to Philadelphia in 1935 to practice with Virginia Alexander. When I was in medical school, Dr. Dickens and I would often talk about the history of Black women physicians. And it was she who urged me to write Dr. Alexander's biography. Dr. Dickens thought it would be a good fit, as both Dr. Alexander and I grew up in poor families in Philadelphia and had interest in the social aspects of medicine and public health. Indeed, my book is dedicated to Dr. Dickens. However, for many years, I was reluctant and being very stubborn. I did not want to write the biography of Virginia Alexander because I thought, and still do, that biography is a very difficult genre of writing to expertly master. There's some really bad biographies up there. I tell you, I've read a lot of them. Or perhaps, as a former graduate student once told me, that writing about African American women physicians would inevitably require some self-reflection on my part. My resistance to writing Dr. Alexander's biography continued, despite links between our lives. We both love Philadelphia. We're both graduates of the University of Pennsylvania, she from its undergraduate school and I from its medical and graduate school. We both lived in Washington, D.C. Her house actually was 3 blocks from where I used to live. We both lived in Alabama. I'm still not getting these connections. What finally convinced me to stop my stubbornness and to write the biography was that I discovered that our ancestors had both been enslaved in Mecklenburg County, Virginia, and at plantations near each other. Now let's get back to the life of Virginia Alexander. Her parents, Hilliard and Virginia Pace, had been born enslaved in Virginia and migrated to Philadelphia in the late 19th century to Ward 7, the area analyzed by W.E.B. Dubois, the sociologist, and his landmark 1899 study, The Philadelphia Negro. Virginia was born on February 4th, 1899, in a racially diverse working-class neighborhood in South Philadelphia adjacent to Ward 7. She had a hard-scrabble childhood. Her mother had died when she was 4, and the family's finances precipitously plummeted after her father lost his successful writing academy when Virginia was a young girl. After his wife's death and the loss of his business, Hilliard Alexander found it difficult to raise Virginia and her 4 siblings and sent them to live with relatives in North Philadelphia. Virginia had a contentious and emotionally distant relationship with her aunt, but a few blocks from her new home, she found inspiration and mentorship from Reverend E.W. Moore, the activist minister of Zion Baptist Church, one of the city's largest Black congregations. And it was he who first pointed out to Virginia the critical relationship between religion and activist activities. Virginia graduated from high school in 1917, and both she and her older brother, Raymond, received academic scholarships to the University of Pennsylvania. Their father strongly supported their educational aspirations because he believed that his lack of an education had led him to lose his business. However, their aunt and uncle did not share their father's enthusiasm for the Alexander children's education. They wanted the siblings not to go to college, but to go to work to support the household. Their aunt announced that if they did not heed her wishes, they were no longer welcome in her home. The siblings desperately wanted to attend college and therefore had to find new homes and employment to support themselves throughout college. Virginia's difficult decision to disrupt her family life proved to be the right choice as she flourished at Penn. And not only did she flourish scholastically at Penn, this picture will, for some people, really resonate. she became a Delta when she was at the University of Pennsylvania. And this, for those who don't know, that's a black sorority. Depending on whether you wear red, it's the black sorority. And that so she joined Delta when she was a student at Penn. She was a scholastically gifted education major, and she received distinguished grades in several subjects, including English, sociology, and German. She blazed through Penn and graduated in 3 years, even though there were times she had to work 20 hours a week in jobs such as being a maid, a cashier, or a waitress. When Virginia Alexander entered the Women's Medical College of Pennsylvania in September 1920, only 65 black women practiced in the United States, 5 of them in Philadelphia. But Virginia found the road to a medical degree rocky. During her first year of school, she failed all of her final exams, in large part because of feelings of marginalization. At Penn, she had been part of a close circle of smart, professionally ambitious African-American students. At Women's Medical, Virginia was the only black person in her class and only one of 2 in the entire school. Racial discrimination intensified her feelings of isolation and adversely affected her grades. As a member of the first-year class basketball team, she expected to attend a dance organized by the players. However, faculty members canceled the event when they heard of Alexander's plans to attend. In March 1921, while still trying to navigate her first year as a medical student, Alexander's classmates held a minstrel show under the auspices of the Young Women's Christian Association to raise funds for Near East relief. The event included students performing in blackface as the Gold Dust Twins, the racist characters from a washing powder advertisement. The program was promoted in the school's bulletin and received support from faculty at the school, suggesting an unwelcome atmosphere for black students at the school. Despite her academic difficulties, the school allowed her to remain if she repeated her first year, and she did. And her scholastic problems never resurfaced, in large part because 2 other black students were her classmates. Alexander's activism began while she was in medical school. In 1924, during her junior year, she led 3 other black students in protest against the racism at Women's Medical. They met with the school dean to denounce the racist behavior of an influential professor who enjoyed, and I quote, telling every discreditable, dirty, and insulting, end quote, stories about black people whenever there were black people in his classes. The professor even went so far as to lecture his black students that he alleged were their attempts to get above their people, informing them that despite their accomplishments, that they would always be Negroes. Virginia and her black classmates contended that they had called the meeting with the dean because our self-respect demanded that we register protests. The dean was not swayed and did not support their grievance. Although the protest was unsuccessful, it marked a milestone in Alexander's activism. Virginia earned a reputation as a careful, earnest, and diligent student. After 5 years of what she called hard grind at Women's Medical, she received her medical degree in June 1925 with 29 other women. By graduation, her professional future finally appeared bright. A few months earlier, her career prospects seemed bleak, as racism and sexism hampered her pursuit of an internship. And this was the case, as was the case for other black women trying to get internships. When Alexander applied to the publicly financed Philadelphia General Hospital, the hospital's director of health told her she would not be appointed even if she was first of 1,000 applicants. Even the internship program operated by Women's Medical was not an option, as it did not accept black women. When Virginia and her classmate Mae Alexander sought an internship at the hospital, A school official acknowledged that the two young women were great students, did good work, and should make great interns, and were deserving of the best that their hospitals offer. In other words, their postgraduate training would have to be at one of the Black hospitals. School officials did work to get them internships at a Black hospital. The school's actions underscore historian David McBride's conclusion that the Black graduates of the Women's Medical College were considered colored doctors who would work towards a predetermined future that was worlds apart from the white medical world. Dr. Katherine Berry Richardson, a women's medical alumna, assisted Alexander and McCarroll in their quest for internships. She had strong ties with African American physicians at the city-operated Kansas City Colored Hospital, or also known as Kansas City Hospital No. 2, and she had a strong relationship with Dr. Thomas C. Unthank, who was the hospital's administrator. The Missouri hospital had a long history of training Black physicians, but had never appointed a woman to any positions. Unthank originally did not want to accept the women because they were women, a reflection of the discrimination that Black women physicians frequently experience from Black male physicians. He eventually relented, and Virginia and Mae McCarroll became the first two women at the hospital. And this here is from the Kansas City Call, which is a Black newspaper, and this was a front page story on how these two women were pioneering physicians. After her internship, Virginia stayed in Kansas City and did her residency at Wheatley Providence Hospital, another Black hospital. Brimming with optimism about her professional prospects, Virginia returned to Philadelphia in 1927. She was ready to open her practice and also to begin the work of improving the health of Black people in North Philadelphia. She began first providing outpatient care in her home, and then in 1930, she renovated her home and started a hospital. This here is a copy of the hospital license. And it was a 3-bed hospital that was in her home. The first two floors were for patients, and the third floor is where she lived with her father. And here is the interior of Esperanto Health Home. This facility provided minor medical care and some surgery. She also considered Esperanto a teaching center for the provision of health education and birth control. 2 years after she had opened the facility, one journal labeled it as an excellent example of intelligent, practical health work for Negroes. Virginia Alexander viewed her practice as inextricably linked to broader social and political concerns. At a time when organized medicine opposed such beliefs, she called her health home a socialized medical practice. And to her, that meant it exemplified service to the community and that it would grow into a group practice. She also saw the Esperanto Health Home as a medical sanctuary from the racism pervasive in Philadelphia hospitals. Alexander's patients encountered firsthand the consequences of such discriminatory practices. In one case, a Black family summoned her to examine their severely burned child, who had been refused admission by a local hospital. She determined that the child needed immediate care and admitted him to her health home. The boy remained there for 4 weeks and then received another 4 weeks of outpatient care. Alexander's medical career blossomed. She maintained a large but not lucrative practice. By 1933, she had treated over 2,000 patients in her office or in their homes. She frequently did not charge her patients, and thus her financial situation was also precarious. Also, she was a really poor money manager. She would get bills and would not pay them. So she did take care of her patients, but also she needed some help with her finances. After almost 8 years of work, she declared, "I have accumulated nothing in the way of the world's goods." Alexander found herself burdened by the demands of a growing solo practice. And so that's when she invited Helen Dickens to come join her in her practice. And the two women practiced together for about 7 years until Dickens left to get further training in obstetrics and gynecology. At a time when the color line in medicine was so rigid, Alexander maintained a uniquely interracial practice, becoming one of the few African Americans to obtain a hospital appointment beyond Philadelphia's 2 black hospitals. Many of Alexander's white patients were Quakers. She had initially established ties with members of the Society of Friends when she was a freshman at Penn and wandered into a Quaker meeting house. She had grown up in the Baptist church, yet from her very first meeting, Virginia felt a spiritual connectedness and found that what she later called worship at its best. Upon returning to Philadelphia after her postgraduate training in Kansas City, political, social, and spiritual factors led her to deepen her ties to the Society of Friends. In September 1930, Virginia Alexander became the first black member of the Race Relations Committee of the Philadelphia yearly meeting of Friends. A major goal of the committee was to develop social scientific strategies to analyze and solve racial problems. Since she was not a friend, she had to join as an unofficial member representing her race. Previously, the committee had excluded African Americans because some members believed that they could speak more freely and with greater disinterest in a solely white community than a mixed one. So this was the Race Relations Committee of the Society of Friends, who believed that in order to best discuss race relations was not to have any black people on it. Just checking that you got that. Okay. Alexander's sincere and abiding friendships with several Quakers led to her pioneering appointment as the first black member of the Race Relations Committee. But at her very first meeting, she gave notice that she would use her new position to urge the group to take action against hospital discrimination. Virginia Alexander's work on the Race Relations Committee influenced her decision to become a Quaker. In December 1930, 3 months after Alexander joined the Race Relations Committee, she applied for membership in the Germantown Monthly Meeting. As the overseers carefully considered her application, some worried about further complications from having a black member, including a potential increase in black members, admission of black children into Quaker schools, and the possibility of interracial marriage. Despite these concerns, her application was approved in February 1931, and for several years, she was the only black Quaker in Philadelphia. Alexander enthusiastically embraced Quakerism. She was known for being late for everything. But when she went to her first Quaker yearly meeting, she was early. And she even called a friend and said, I was early today. And she continued to use her connections with the Quakers to fight racism in medicine and to advocate for health equity. 80 years before Mary Bassett's New England Journal of Medicine essay, in which she contended that health professionals should undertake critical research in racism and health, Virginia Alexander had already been engaged in that important work. In July 1935, 5 years after her first appointment to the Race Relations Committee, she guided the direction of the 3rd Annual Institute of Race Relations. Alexander conceived, co-directed, and obtained funding for an interracial team to investigate the social, economic, and health problems of her North Philadelphia neighborhood. That was so central to her life and career. Her work on this project was personal, it was political, and it was professional. The study was a clear example of what today we might call action-oriented research, as she planned to translate her research into practical solutions to address the health problems of African Americans. She wrote most of the final report, The Social, Economic, and Health Problems of North Philadelphia Negroes and their relation to a proposed interracial public health demonstration project. Writing with what historian David McBride has called articulateness and fire, Alexander used quantitative and qualitative data to illuminate the status of Black patients and physicians in Philadelphia. The 132-page typewritten report was divided into 4 parts. The first part provided a detailed overview of the health, economic, and social status of Black North Philadelphians, who at the time represented about 30% of the city's Black population. The second part describes the results of a survey of the status of approximately 500 Black families in the area. The third part of the report presented the results of a study of the professional experiences of 39 Black physicians. The last section was an analysis of the policies of local hospitals towards Black physicians and patients. Alexander's final report painted a bleak picture of the health of Black Philadelphians. For example, in 1926, Black infants died almost twice as often as white infants. And I have to point out, we're still struggling with that today. African Americans had 6 times the tuberculosis rates as whites. Alexander attributed these sobering statistics primarily to social and political factors, such as inadequate housing, education, and unemployment. She found that of the 50 families surveyed, 47% had an unemployed head of the household. Alexander also pointed to racism as a contributing factor for the poor health of Black North Philadelphians. Alexander vividly and graphically documented the role that hospital discrimination played in creating and maintaining health inequities. She discovered that many hospitals in the city excluded Black patients or cared for them in separate wards. Alexander labeled one hospital as outstandingly unfriendly to colored people. She also used the words of Black patients to illustrate the racism that they face as they sought treatment. One woman recounted her experiences seeking medical care for her child. I didn't like St. Luke's and Children's Hospital Clinic. I wouldn't go there again. The resident doctor called my child a cannibal because she didn't stop chewing gum the minute he asked her to stop. Another described her fears about being involuntarily sterilized if she were admitted to one of the city's hospitals. I was told to go to Hahnemann for an operation, but I was afraid to go because they always tell you that you need an operation when you don't, and then you can't have any more babies. In the 1935 report, Alexander also revealed that the city's Black physicians faced steep obstacles. She discussed how often when Black physicians were fortunate enough to receive admitting privileges at Philadelphia's white hospitals, that they encountered hostilities, as she herself knew firsthand. In one instance, she went to an outpatient clinic to inquire about the status of a patient. The intern who answered the door assumed that she was a patient and chastised her for coming after clinic hours. Alexander was shocked by the discourteous, reproachful attack that she received from this intern, who she said did not know me from any other colored woman. She added, when I thanked her and said, I am Dr. Alexander, and turned away, I think I taught a lesson in race relations. In describing the cold reception that she received at Jefferson Hospital, Dr. Alexander observed that most of the staff seemed unable to rise to the situation of having ordinary civil or professional relationships with a colored doctor. Nurses and even elevator operators treated her disrespectfully. Alexander acknowledged the importance of the city's 2 Black hospitals, but conceded that they could not adequately meet the professional and medical needs of Black Philadelphians. She recognized that her career was anomalous for an African American woman because she had access to a Black hospital. Alexander's research and clinical experiences expanded her awareness of the lack of public health facilities and training for African Americans in Philadelphia. She recommended that an interracial health center be established to serve as the focus of a public health movement for the city's Black population. The center would provide medical care, health education, and also political training for Black nurses and physicians, and serve as a model for interracial medical work, thereby promoting racial understanding. Alexander believed that interracial dialogue and contact were effective tools to combat racism. She did not view the poor health status of African Americans as a race problem that should be addressed solely by African Americans. She believed that any successful campaign to improve the health and health care of Black people required participation from both Black and white health professionals. Alexander could not get the funding for her proposed health center, but her study influenced the 1941 opening of a health center in Philadelphia. The 1935 North Philadelphia study highlighted the exclusion of Black health professionals from the 3 city hospitals, including Philadelphia General Hospital. As a member of the Race Relations Committee, Alexander had forcefully brought the problem of hospital discrimination to the predominantly white committee and successfully lobbied it to take action. Between 1937 and 1940, Philadelphia General Hospital appointed 3 African American physicians to its staff. One committee member observed that largely because of her firm but reconciling approach, hospital doors were open that had been shut. However, Alexander failed in an earlier effort to get Friends Hospital, a Quaker-operated mental institution, to reverse its racially exclusionary admissions policy and admit one of her patients. Alexander's family would later become the target of racial discrimination by the Quakers. In 1938, Alexander submitted an application to get her 3-year-old niece, who was also her godchild, admitted to the school associated with her friend's meeting. And that's a picture of Virginia Alexander in the back with her niece when she was born, and then when she was about two years old. The admissions committee, however, rejected the application because the time has not yet come for the natural, happy, and helpful admission of Negro children in our school. Members of the committee feared that desegregation of the school would jeopardize the school's financial stability. Their financial concerns were well-founded. The previous year, Media Friends School had experienced a large deficit because several families had withdrawn their children after a Black student had been admitted. In an April 1938 meeting that Alexander described as neither easy nor pleasant, the admissions committee revealed its decision. She cried as she heard that the school had rejected her niece solely because she was Black. "I wept," she lamented, as one would weep when one began to realize her helplessness in a situation which one had felt was soluble here and now, soluble through courageous, earnest seeking. Committee members hoped that she would persevere with her friendly association and contact, and she did. However, the rejection embraced her with profound grief. 11 days after the meeting, she wrote her funeral wishes on the back of an envelope. She wanted a Quaker-style memorial, but not in a meeting house. In a letter to her sister-in-law describing this painful meeting, Virginia concluded by asking, how long and why? The Quakers' rejection of Virginia's patient and her niece explode, I think, the image of the mythic Quaker as unwavering champion of racial justice. If I have researched Alexander's life, I have struggled with the question, why after the painful incident with her niece did she remain a Quaker? Perhaps that is not the right question, and perhaps that question says more about me than it does about Virginia Alexander. A more appropriate question might be, is what attracted her to Quakerism, especially at a time when most African Americans, including her family members, embraced Black religious culture? I think that membership in the Society of Friends allowed her to craft a career that linked her religious affiliation, public health research, and anti-racist activism. Virginia Alexander's religious faith spiritually sustained her throughout her remarkable career. Indeed, Quakerism suited her religious temperament. She contended that in its silent meditations offered her spiritual renewal and perfection in prayer. A fellow Quaker remarked on how quickly Virginia would settle into the mood of deep worship when she arrived to a meeting. Virginia once declared, "Try if I would, I could not overcome the influence of Quakerism." She said that the painful episode of her niece's rejection had caused her to lose her zest for her meeting, but made plain that the substance of my faith is very, very real to me. Thus, Alexander made a distinction between the principles of Quakerism and the actions of individual Quakers. Despite the racism in their own rights, the Quakers maintained two of the few predominantly white committees that attempted to address the problem of racial discrimination in Philadelphia: the Race Relations Committee of the Philadelphia Yearly Meeting and the American Friends Service Committee, and she was on both committees. If she were to leave the Quakers, she would lose an important arena in which to fight racism and influence the racial attitudes of white Americans, whose influence could be put to use in dismantling racial discrimination in medical care. In her work, Alexander frequently bore witness to the humiliation and pain that she suffered as a Black woman physician, as a way to influence the racial attitudes of white Quakers and to prompt them into action. Marjorie Penny, a white friend and a patient of Dr. Alexander, who operated an interracial settlement house, called Alexander her conscience. She once observed that the white community needed Alexander more than the Black community because of her poise, patience, and skill constituted a reproach to racism. Penny described her reaction to hearing Alexander talk about her experiences as a Black woman physician in the 1930s. Back in 1932, she wrote, "I heard Virginia tell simply and without rancor of her experience as a colored woman doctor. That was an expensive evening for me. It cost me my peace of mind that any creature, let alone one so gifted, should suffer so, made me deeply angry. I was ashamed to speak to her after the close of the meeting. As evidence of the possibilities of Alexander's moral suasion, her quiet but powerful testimony spurred Penny to action to promote interracial understanding. As Alexander's career advanced, she increasingly focused on the role that social factors played in the health of African Americans. Her interest reflected, in part, the intellectual influence of the prominent sociologist and civil rights activist W.E.B. Du Bois, with whom she had begun an intimate relationship in the early 1930s. It is not clear how long Virginia and Du Bois maintained their relationship, but they remained close until her death, at which time he telegrammed the family conveying his deepest sorrow at the death of Virginia, my long-loved friend. Du Bois had several extramarital affairs, but his biographer, David Levering Lewis, has called his relationship with Virginia one of his deepest and most enduring. Du Bois had contended, most notably in 1906's The Health and Physique of the Negro American, that racial health inequities stem primarily from social, economic, and sanitary conditions, and not from, as was then widely believed, from inherent racial traits. Du Bois' emphasis on the connection between rigorous scholarship and social activism is clearly reflected in Alexander's work. Dubois encouraged her to take graduate courses at Penn, and she did. However, she decided that she wanted to go to, she wanted to study public health because she felt that the disciplined study and research in public health was most fitting for her professional aspirations. And she applied to the doctoral program at Yale. She immediately encountered obstacles. Lacking financial resources, she tried to get money from a foundation. However, the director of the Negro Health Program of the foundation replied that she did not meet the funding criteria. Another disappointment followed when Dr. C.E.A. Winslow, a prominent public health leader and chair of the Department of Public Health at Yale, notified her that she did not have the prerequisites for admission to the university. Nonetheless, she remained tenacious. She secured a loan from a Quaker friend and convinced Winslow of her qualifications, and in October 1936, she became the first African American to study public health at Yale. But ill health forced her to leave after 1 year. For at least 3 years prior to her matriculation at Yale, Alexander had suffered intermittently from vague symptoms such as rheumatism and fatigue. Her health deteriorated at Yale, and in March 1937, she was admitted to the New Haven Hospital after the onset of diarrhea, fatigue, and shoulder pain. Her symptoms abruptly subsided, and she was discharged after 3 days. 4 months later, after she was admitted with similar symptoms to the hospital of the University of Pennsylvania, she was diagnosed with lupus. Lupus, a chronic inflammatory disease of unknown etiology, can affect several organs, including the skin, joints, lungs, kidneys, and the nervous system. The disease is characterized by periods of remission and relapse. The disease would constantly plague Alexander in both its chronic and acute manifestations. She often had a rash on her face called a butterfly rash of lupus, and she also suffered from fatigue and pain in her legs. Alexander's medical connections allowed her to receive pioneering treatment for the disease, but the treatment of the disease in the 1930s had included things such as blood transfusions, testosterone, bismuth, gold, and bed rest. And in the 1930s, it had a 99% mortality rate after 5 years. Alexander was hospitalized several times because of her disease. During a 14-month period between 1937 and 1938, she was admitted 3 times. Lupus also wreaked havoc on Alexander's financial status. The cost of hospital insurance and expensive medications continuously threatened to topple her already unstable financial situation. There were also times when she should have stopped working, but continued to do so because she needed the money and feared that a prolonged absence from work would jeopardize her professionally. Ultimately, Alexander's disease precipitated a major crisis. In 1937, she moved to Washington, D.C., and began what she called her voluntary exile from her beloved Philadelphia, an exile that lasted 9 years. She did not feel she had the stamina to maintain a private practice, and she did not want her family to see her so dull and incapable because of her illness. She accepted a position as assistant university physician at Howard University, where she worked under supervision of Dr. Paul Cornell, another physician activist and public health researcher who in 1934 became the first African American to get a doctorate in public health, and who in 1969 became the first African American president of the American Public Health Association. In 1939, Alexander and Cornell co-authored an article that analyzed the wide gap in health status between Black and white Americans. Their proposed solutions included the desegregation of health facilities, the creation of public health activities targeted to the Black community, and the passage of the 1939 National Health Bill, which included a plan for national health insurance. Also in 1939, in addition to her activities at Howard, Alexander became a physician for the National Youth Administration, an agency established to provide education, jobs, recreation, and counseling for unemployed youth. In 1941, after writing her thesis on the health status of African Americans who worked at the National Youth Administration, she finally received her master's degree from Yale and became the first Black woman to receive a medical degree from Yale. Alexander left Washington in 1943 and went to Birmingham, Alabama, where she worked in a public health clinic and worked in the clinics in venereal disease, maternal and child health, and also in birth control. Virginia Alexander's activism, public health training, and research placed her at the vanguard of Black public health professionals and led to her having a highly regarded professional reputation. For example, in January 1938, the Children's Bureau invited her to be a delegate to its conference on improving the health of mothers and children, especially African Americans. The executive director of the Baltimore Urban League harshly criticized the Children's Bureau for failing to invite any of the Black attendees to speak. He contended that if Alexander had been allowed to present her research, she would have given some extraordinary insights on infant and maternal mortality so far as colored people are concerned. Virginia Alexander returned to Philadelphia in 1945, only able to resume a limited practice because of her poor health. She once again became a member of the Friends Race Relations Committee. Although she remained a committed Quaker, towards the end of her life, she began to express impatience about the continuing plight of African Americans and doubts about Quaker methods to advance racial equality. On Independence Day, 1944, while at the Mayo Clinic for treatment of her lupus, Alexander wrote a letter to her sister-in-law in which she described the racism that she had encountered in Rochester, Minnesota. Hotels barred her, and restaurants refused to serve her. She also discussed her impatience with the continuing plight of Quaker methods to address the problems of African Americans. She wrote, "I am thinking of a new technique for handling such racially discriminatory situations, and it's not a Quakerly way, nor one that I could adopt. But it seems to me that others of us who become unwilling to go the slower way of conference, arbitration, and power of the ballot methods may have to resort to an underground sabotage method that will make discriminating classes feel the immediate cause of hatred and discriminatory measures. North, South, East, and West, we are having a rotten experience." However, her frustration did not lead her to abandon her belief in interracial cooperation or in the Quakers. The last years of Virginia Alexander's life were dominated by her battle with lupus. She died at the age of 50 on July 24, 1949. Although she had lived with lupus for over 13 years, she had tried not to let it interfere with her work. Indeed, there were times when she woefully neglected her health. For example, on January 13, 1942, Virginia Alexander wrote to her sister-in-law, "Dr. Rose almost talked me into going into hospital for a rest cure. I should have done it, but I did not want to jeopardize my future professionally and socially, nor did I want to worry my family. This morning I felt that I could scarcely make it, and several times today I let out a cry on account of pain in my leg. But at this moment, 3:45 p.m., I am feeling grand. My leg has not ached for nearly 2 hours. I put an ace bandage on it yesterday and told all the folks here that I sprained my ankle. It has helped a lot, the bandage, of course, and I am sure that I will soon be feeling as well as everyone says I look." Her sister-in-law urged her to take better care of herself because the social problems that confront you and me cannot be solved in our generation. However, Virginia Alexander continued working, and 2 months after writing that letter to her sister-in-law, she was admitted to the hospital critically ill. During her 14-day hospitalization, her family feared that she would die, because as one of her physicians told them, no one knew the cause of her disease, and therefore they did not know how to treat it. In the decades after Alexander's death, most notably within the past 30 years, there has been a burgeoning interest in the United States in eliminating racial and ethnic inequities in healthcare. At the same time, there's been a growing discussion about the public roles and professional obligations of physicians and other health professionals in tackling social ills. The biography of Virginia Alexander sheds historical light on both of these issues. Her story reminds us that the efforts to address these stubborn inequities have had a long history, and her career provides insights into the substance and character of past efforts to eliminate racial and ethnic health disparities. Virginia Alexander saw her medical practice as inextricably linked to broader social and political concerns and crafted her career accordingly. She understood that the improvement of the health of African Americans could not be solved solely by the medical profession, but religious and civic organizations, political activism, research, and public health were also important. Until her death, Virginia Alexander remained a champion for justice in healthcare. 6 weeks before her final hospitalization, she attended her last Race Relations Committee meeting. Almost 20 years after she had first brought the issue before the committee, the agenda included a discussion about strategies to combat hospital discrimination, a fitting tribute to her influence and tenacity. 9 years before her death, the Pennsylvania Institute of Negro Health honored Virginia Alexander in a ceremony in her native Philadelphia. The Institute recognized her work in operating her small hospital and in heading her investigation of the health conditions in North Philadelphia. And its coverage of the event, her hometown paper, the Philadelphia Inquirer, praised Dr. Alexander as one of the country's most foremost black physicians and noted that black medical leaders in Philadelphia considered her their foremost worker in public health. Indeed, the award bestowed on Virginia Alexander was for recognition of outstanding services to Negro health. What a fitting tribute for Virginia M. Alexander, a passionate advocate for health equity long before it reached prominence as a national public health issue. Thank you very much.
Thank you so. Hello?
You can hear it.
Thank you so much, Dr. Northington Gamble, for that.
Thank you
that
very
was
much.
wonderful.
Thank you.
We'd like to open it up for questions now. There are mics on either side of the auditorium.
I'll just wait my turn in line, don't worry. Thank you so much for sharing the powerful story and history. From where I'm sitting, it leaves me feeling kind of depressed. So I'm looking to you so you can help maybe be uplifting in what I think are trying times that are very different from the time she lived in, but in many ways are not. And I think one of the things that struck out to me the most about the story was her engagement with the Quaker committees. And while there was a willingness to have those committees and have those conversations, there was a noticeable gap between things they talked about and their willingness to take meaningful action. And I guess I feel like that's very much the case today, where we're often willing to talk about issues and have conversations, but translating those conversations to action is often absent. So I'm wondering, through the lens of a historian, what do you think we can learn in terms of where the greatest opportunities are to move actions forward?
Well, first of all, I don't think you should be depressed. Because, and the reason I say that, there were many disturbing and distressing and depressing aspects of her life, but she kept going. One of the things that I have learned about writing about Virginia Alexander is the importance of faith, and not just faith in the religious sense, but faith that this will be over, and that she continued. And that's one of the things that that as I went through her life, because when I started this, it was going to be like this uplifting story, this black woman against the odds, and she triumphed. But that's only part of the story. She did triumph. She triumphed in terms of being a poor child, and, and not seeing a black woman physician and somehow saying, this is what I'm going to do. So she triumphed in that way. But the thing that I took away from this story, and I think would help us today, is to don't give up. So she didn't give up in terms of her health. She did not give up in terms of her financial situation. She did not give up in terms of her writing. And so that's what I take from her story. And so I don't find it depressing at all, even though there's a part, she was a complex and complicated woman. And that I think the fact that she, here's somebody who flunked all of her first year medical school courses, and then somehow, continued to go on. So that's what I would continue to go on, is what I would argue.
I just wanted to thank you again for an incredible presentation of an incredible life. I learned so much during this presentation, and I also was struck by, I feel in so many ways, the very same problems that she was facing during her life we're still facing, and that can lead to frustration, disappointment, but I think you're right. We do have to keep going. We can't give up. So the root causes are so complex, and I think come from, as you reference, societal, economic, job-related, every which way. But I'm curious, if you could choose, what do you think is the one societal construct that you think creates the most disparity in cross-ethnic health? And if you could change one, what would it be?
I don't think I could do that.
There's too many.
I don't think I could,
There's too much.
I could select one. One of the things that, having, been trained as a physician, it was always like a medical lens. And one of the things that I think that has happened is that as we do more research in health inequities, is that we see it's multifactorial. So now, I used to just talk with the docs and maybe every now and then with the public health people, but now it's like we're talking to people who do educational injustice, people who do criminal justice. So I don't think that there's one that I would be able to select.
More than fair. Thank you.
So we brought.
Hi.
Yes, one of the things about you being a historian, you find, all the different things. So she did not get in, and when her niece did not, Mary Elizabeth did not get in, it was also at the same time that the Quaker school admitted the son of a Nazi sympathizer. So they did not take a black student, but they took the son of a Nazi sympathizer. Then when her daughter, when Mary Elizabeth's sister applied, she did not get in. And I was going through at this one school trying to find out who was the first black person admitted to this Quaker school. And it turns out it was someone I went to medical school with, who was the third generation of his family who had graduated from the University of Pennsylvania Medical School. And so there were other Quaker schools that did admit African Americans before Germantown Friends did.
Hi, thank you, Dr. Gamble. My name is Damian Lyles. I'm a public health student here at Georgia State. late into the game, but I consider myself a public advocate, and once again, a public health advocate, and I thank you for what you've done, and I like to consider myself an activist as well. And I'd like to know, in your research, did you notice anything? Of course, we've made some strides in the field, but is there anything in your research from the 1930s, 1940s that you noticed with Dr. Alexander that's just glaringly not made the improvements that you would think that we're entering now that we're entering 2020?
Well, I mean, one of the ones that struck me was the one about infant mortality, that she found in 1935 that the black infant mortality in Philadelphia was twice the white rate of infant, and so when we think about that in terms of infant mortality, I think that's one that we have had a hard time, addressing, and that we really need to keep trying on that one. I mean, and the other thing, too, that I thought was important in the study that she did in 1935 is that she went and asked patients about their experiences, to say, what was your health care like? What has your health care been like? And so to try to go to the community to get some indication of where some of the solutions might be.
Sorry. You answered a previous gentleman's question when he was saying he was depressed. You said the hope in Virginia's story was the fact that she continued on anyway, to the point where it was a detriment to her own health. And so my question is, in a time where health inequity still exists, what is the balance that Black women in particular must strike to where the work doesn't kill us?
Right. Well, I totally, what's very interesting is that I mentioned in the beginning of my my talk that I had a graduate student who once said to me that if my work on looking at Black women physicians if I did it right, would require some self-reflection. And I think you hit the nail on the head in that the importance of self-care, the importance of communities, the importance of allies. And so, her sister said you need to take care of yourself. I mean, there's even, I didn't include it in this talk, there's even Dubois telling her you really need to take care of your health. So the balance is so it's not to give up, but at the same time, not to give up on yourself. And so that one of the things that, and I really, had problems with the fact that she stayed with the Quakers. Now I understand it better, because I was like, if it was me, I would have left. But as a friend reminded me, this is not about me, it's about Virginia Alexander. And because I think, too, that gave her comfort. And one of the things, and I had a Quaker friend explain this to me in a way that I did not understand previously, that when she went to Quaker meeting, she could just sit and be. If she wanted to get up and talk, she could. If she just wanted to stay there and just sit. And so that gave her a certain comfort, a certain sanctuary. But I think that you are that we have to be very careful to make sure that we don't give up, we don't keep going to the point, as you said it most appropriately, that we don't end up killing ourselves. So that one of the things I have learned from the Virginia Alexander story is, one, I moved back to Philadelphia. And two, I also learned of the importance of taking care of myself.
Hi, Dr. Gamble.
Hi.
Thank you for answering these questions. In your last statement, you mentioned the importance of having allies and in that process of taking care of yourself. And so I just have a question, as a woman of color, what would you say to allies, to support women of color, especially in the medical field and public health? What are some things that they can do? Because oftentimes we're looked at as the ones to come up with the solutions, and kind of following Dr. Alexander's model of it's going to take both sides to get, the work done, but it can't solely be on the backs of Black women or women of color.
Okay, the first thing I would say is listen. Because sometimes the conversations have to be, about listening. And also to make plain that my experiences might be very different than other people's experiences. And that some of my white friends who are my closest white friends know that there are times where I have to be with myself and with people can understand where I am. But that's not to say that I can't talk with them about it, but that I need to have, at least in my life, lots of different people who can, that I am many different people, and that I need to have different people to help me in terms of the different aspects of my life. And I think, and the reason I started with listen is that sometimes I know I have found in my life where when I would bring up something, it was denigrated or not, or seen as like I was just being, that glorious word, I was being overly sensitive. And that, to say is like, oh, no, this is what my experience is. And like, let's have this conversation. Now, I spend a lot of time talking with white students about issues around race. And I will say to them, you might not know what it feels like, what racism feels, to be Black in America. But you know how it is to feel denigrated. You know how it feels to be dismissed. You know how it feels to be frustrated. And so that to try to have conversation with my allies, along those lines. And the other thing too is, I do believe that in terms of racial and ethnic inequities, we cannot just look at this as a race issue, or it will never be solved.
Dr. Alexander, I just want to thank you.
Dr. Alexander, that's
Oh,
great.
yes.
That's fine.
That's exactly right. I'm channeling that. Dr. Northington Gamble, thank you so very much for coming and sharing your wisdom and your biography of Dr. Alexander with us today. I can only tell you, I have a whole bunch of questions over here, but
Okay, I have lunch.
So I have a ton of questions, but I will tell you that as a African-American female in public health, the story was inspiring to me, and it was sad to me. I can understand Harry's comments as well, because it does feel like we haven't come very far. But there were two things that you said, and I don't remember exactly the context, but they're the two things that I try to stress with my students, and that's about the difference between helplessness and hopelessness, and why we have to have hope in order to believe that we can actually make a difference in some of these things, even though they seem so irretractable. But thank you again so much for coming and sharing your wisdom with us. I pray that your words will help us to just be a catalyst for us to all continue to try very hard to address these issues and to make a difference. If you will, we'll have a reception right in the other hall, so please join us over there.